In oral pathology, we don't just look at the spots, we look at the architecture. Here is the breakdown of epithelial dysplasia stages by their histological depth, but with a twist of diagrammatical representation that is made by me to score full marks in this question during my professional exams. So let's discuss about mild dysplasia. Features like nuclear pleomorphism, mitotic figures, slight increase in nuclear to cytoplasmic ratio is limited to the basal and parabasal layers. If you see the visual key, only bottom 1/3 of the epithelium is affected, and clinically, it is often reversible if the chronic irritant is removed. Now let's move on to moderate dysplasia. The abnormal cells migrate in the upper direction. You will see a loss of polarity. That is, the cells no longer know which way is upside. They have significant architectural disorganization, increasingly increased nuclear to cytoplasmic ratio. They might show subtle individual cell keratinizations, and there is a prominent teardrop-shaped rete ridges. If you see visually, the involvement extends into the middle third of the epithelium thickness, and clinically, at this stage, the risk of progression increases significantly and surgical intervention is usually discussed. Now we are moving to the most serious one, that is the severe dysplasia. The architecture is significantly crowded. We see prominent nucleoli and hyperchromatism reaching the top of the tissues, marked complete loss of stratification and cohesion. They have pronounced pleomorphism, prominent nucleoli, bizarre cell formation that is marked with high nuclear to cytoplasmic ratio, and possible keratin pulse formation with epithelium. After this, we have another stage called carcinoma in situ, that is CIS. This is the top to bottom change. You will see full thickness atypical and mitotic figures, even near the surface. And the golden rule is the basement membrane remains intact. Visually, there is no invasion into the underlying connective tissue. Once it breaks that membrane, it becomes a squamous cell carcinoma. Now comes the most interesting part. The trick that I have made is actually, in spite of making 3 different diagrams while differentiating between the mild, moderate and severe dysplasia, what you can do, you can draw a single circle and divide it into 3 equal parts. And then you can show the diagrams, or you can make the diagrams of mild, moderate and severe dysplasia in a single circle. So it will be easier for the examiner to differentiate and for you also to mark the proper features in a single diagram. If you found this video helpful, you can follow me on my Instagram handle and we can focus on another topics of oral pathology in depth.